Hey, this is Dr. Lowenstein, and I wanted to just make a little video and tell you about a patient that I talked to yesterday. I called to check up on him last week just to see how he's doing. He's about 3 months out after surgery, and I didn't hear from him until, what is today? Yesterday, which is Monday. And he tells me that from a surgery standpoint, he's doing fantastically and is extraordinarily thankful. It's a really, really nice conversation. His pain is vastly improved, and he's trying to treat his pain with just some Excedrin. And the reason he's doing that with Excedrin is he was on huge amounts of narcotics. And he was living his life. He's a father, husband, successful business guy, and just a really great guy all around. And he was managing his life day to day on a lot of narcotics. And he's told me that recovery from the actual surgery and the improvement of his pain has been spectacular. However, getting off of these narcotics has been very, very difficult, and he's very excited that he's hoping to be off of all of his narcotics as of this coming Friday, which would be great. But I want to emphasize to everybody that it's, narcotics, nobody wants to talk about the fact that just because you need narcotics for pain management, that does not make you an addict or one of the problematic people in the world as far as opioids go. But if you can possibly avoid getting on narcotics and opioids in the first place, you're much, much better off. And so if other, triptans or other kinds of migraine medications that neurologists will put you on work, fantastic. But before you go down the route of narcotics, I strongly suggest that you look into migraine surgery. If not, discuss with pain management people about injections and other things. But once you're on that narcotics wheel, it can be very, very difficult to get off. And I really want to do everything I can to prevent patients from having to go through what this gentleman is going through, which is great improvement of his pain from the surgery, but now that he doesn't need the narcotics, they're just very, very hard to get off of, and I feel badly for him, but I'm really proud of him that he's down to a sliver of one pill off after being on many, many pills and fentanyl patches and just a world of difficulty. So that's my 2 cents, and I really hope that we can prevent people from having to suffer through narcotics withdrawal as one of the advantages of migraine surgery. All right, thanks for listening.